Okay, so I'd like to introduce our second speaker. Ara ko tōna ingoa ko Analosa. And Analosa hails from the beautiful island of Hamua. So she is of Samoan ethnicity and is from the villages of Siuwhanga. Excuse me if my pronunciation isn't too cool, I'm trying. Whalelatai and Malie. Her husband is Peter at the back, looking after the baba, who's 8 months old, and the beautiful baby girl there too, as it looks like she's matching, wearing the same kind of colours as her mama. And Peter's parents are from the villages of Matahau and Homa and Tonga, and their 2 children are Paula and Michael. So Michael, the little baby crawling around, and Paula, the beautiful 3-year-old girl at the back there. Analosa has experience in clinical research, management and community settings. She is also a principal consultant at Integrity Professionals, that's IPRO for short, and it is a Pacific-led strategic consultancy and project management service. In 2012, Analosa developed a best practice framework for the delivery of sexual health promotion services for Pacific communities in New Zealand on behalf of the Ministry of Health. And big up to the Ministry of Health for all the putia. So you may know that there is a book over there, and I see that everyone's probably collected them a copy. That's for your perusal after our hui. Right now we've got the real thing in front of us, so we don't need to read the book, we can have a look at that afterwards. Can't wait. Analosa has worked predominantly with Pacific communities and has held social work, tertiary liaison and management roles. Very, very qualified our Analosa is. She's also a qualified social worker and is a member of the Aotearoa New Zealand Association of Social Workers. Analosa is currently completing her PhD studies. That deserves another clap. Those of us who are academics or aspiring academics, a PhD is no mean feat, so we do give it up to you, Analosa, for doing that mahi. So she's doing her studies through Massey University, and her project explores the factors that influence the sexual health knowledge, attitudes and behaviour for Samoan youth in Aotearoa New Zealand. And from Matua Hoturua's kōrero, we note that attitude is very big on the waka, and especially for our rangatahi, if we get those attitudes right and their focus, give them the appropriate resources to be able to do what they need to do, then that is halfway there towards creating a confident global citizen for Aotearoa. So Analosa's deep commitment to improving the health of communities within Aotearoa is driven primarily from the influence of her Christian faith. And also must refer back to Matua Hoturua's kōrero, even the most atheist of us, those who don't have beliefs, that don't really stand for a God as such, when you're out on that water in those 12-foot swells, who are you praying to? That's right. So kia ora. To all the faiths amongst us and those who believe in gods, no mai ki tēnei o ngā hui. So, homai te paki.
Kia ora tātou toi kia mō mātou te tua. Te tua oro atu nei au I tō teina tuakana. Mai roto mai te moana nui akira. Nau mai, haere mai. Tūrau, reo oro mai, niki mai. Rea ka mitaki nei a mātou ia koe. No tō o tuatua I te ara. Te tuatua aroa, te tuatua ke akakite. Te tuatua e aki ana. No mātou, e roto I tō mātou au ananga. No reira, tūrau, oro mai. Kia ora.
Tēnā koutou katoa. Nā mihi mahana ki nā tangata whenua. Nā mihi mahana ki te whenua. Nā mihi hoki ki nā iwi katoa. Ko Māngere te maunga. Ko Manukau Haba te moana. Ko Ngati Hamua te iwi. Ko Siuwhanga Whalalakai te hapu. Ko Analosa Veukiso-Ulugia toku ingoa. Nō reira, tēnā koutou, tēnā tātou koutou katoa. Māloe lelei, kia ora ana koutou katoa toa, whakalowhalahi atu, taloha ni pula vinaka. O te whaatalofa atu le paia ma le malu, wa awhia mai lene yaso. O tau sāma whai ngā, o le ale o iai se leo au auna. Ai nei sese upu, o na avea lea malape o lo nei tangata. Hawtai mo le awhio mai, matala mai au i lene wha moe moe. Ai ia lofa le atua, ia whaise au ngā o lene ia o onga, mo o tau, ma mātou fo i tupunanga. I le oawa, ma lo whaalo alo tele, ia manuia le tātou aso, papitai. So thank you for the invitation to share with you today a piece of work that I think has a place amongst those stars that we've talked about. So I know that I've got the best timing for a presentation. You know, your spirits have been uplifted from such a humbling welcome and fellowshipping opportunity. Your bodies have been thoroughly exercised, so many of you guys have been up quite early and travelled from afar to be here. And your bellies are actually quite full from all this like afternoon tea, lunch, and more afternoon tea. And also the sharing from Putaroku, you know, what can I say? You know, our priest often talks about wholeness, about being in a place of, or being holy, and it's about when we have all of those things, our minds, our bodies, and our spirits thoroughly exercised. So I can understand if some of you guys decide to end up sort of praying in a horizontal position when I speak, but okay, where's our Veukiso? So the concept of stars, it's the central theme of this consortium, drawing on the treasures of our cultural stars, and then being a guide to our destination, and this idea of creating new stars. And I guess we've all heard the term reach for the stars. And I guess in the context, yes, that's my other star. Yeah, in the context of this presentation, if we're thinking about evidence or evidence-based practice, you know, I'm going to ask the question, is it as easy as it's made out to be? This term evidence-based. I mean, we hear it, you know, we see it in all of our government contracts. You know, our Prime Minister and respective leaders are often quoted using this term. And I guess I'm one of those people, you know, when I'm sitting there listening to a speaker, I'm sort of wondering, okay, you know, what does that actually mean? What does that mean in the practice, you know, in the people that I meet? You know, is it an additional thing that you do, you know, add to the to-do list? Or is it something inherent in the way we actually practice? So this afternoon I'm going to be presenting to you some work, you know, which we call the Best Practice Framework for the Delivery of Sexual Health Promotion Services to Pacific Communities here in Aotearoa, New Zealand. And I know it's a mouthful, and but hopefully, you know, from this presentation you'll be able to get a gist of it, that you'll be able to actually go and tell your neighbour about this framework. So I'm going to be talking about how it came about. I'm going to discuss some of the key features, talk about some of the challenges, and I'm going to end with some thoughts on so what, you know, where to from here. So I guess, you know, throughout the course of this consortium, you're going to have an opportunity to discuss things, you know, this previous presentation that we've had and this one here, about how will it apply in the work that you're doing. Will it empower you? So this particular framework, did it drop out of the sky? Actually, no. In terms of the background, the Ministry of Health, tomorrow you're going to be discussing a draft program logic model. And generally what they found, they had done some work and they found what was found, you know, generally effective for the, you know, general population. But what they definitely identified was actually, they didn't really know what was actually effective for Pacific and Māori communities. So as a result, in late 2011, the Ministry requested some assistance in developing this framework. So, I mean, my take on the really long title, my Google take, is that if you're looking at delivering effective sexual health promotion services to Pacific peoples, what are the key features? What are the best bets in terms of where you place things, you focus your attention, and what's needed in your toolkit if you're going to work with our communities? And I guess, some of you in the room might think, oh, Losa, that was developed only for Pacific communities. It's not relevant to the work that I do. For the Māori in the room, I'm going to say to you, as Huturo shared, we've actually got a long and shared treasured history. There are differences between our cultures, but actually many similarities in our worldviews, language, culture, and especially when we think about the changing demographic of New Zealand. And some of you might be non-Pacific, non-Māori. And I'm telling you, if you get this right for Pacific, you definitely have lifted your game. You'll actually have a more chance of getting it right for everyone in our community. So with this, I ask that you keep an open mind. So in terms of starting out, I did undertake a literature review. And what I found was that there was actually very little that was written about this area of sexual health promotion, especially in the area of Pacific and effectiveness. So I did have to look further, and we are blessed there is a growing pool of evidence, and especially in the area of mental health, sexual violence, and also the alcohol sector. And I want to bring it back to this issue about literature. I found that some, in terms of keeping with the times, as organisations, individuals really need to think carefully about the opportunities to actually publish your work. Because you'll find that often when a lot of major government departments are looking at reviewing something, one of the first things they'll often commission is a literature review. And I know for many, I can speak for Pacific and maybe for Māori as well, ours is an oral history. And traditions actually have been passed down in other mediums. The spoken word, art. However, this is one area that we need to actually look more into. So, having undertaken the literature review, I actually went out and met with 4 of our Pacific providers, and I want to, at this point in time, I want to acknowledge and thank them all. I hope that this work that I'll be presenting hopefully reflects, your time, your talents, and your treasures. Not only did I speak with 4 of our Pacific providers, I went further afield and there was a total of 11 individuals, and they reflected the variety in terms of the area of sexual health promotion. So we also included family planning, Auckland Sexual Health Society, the New Zealand AIDS Foundation, but we also had some input in terms of clinical staff and also the Ministry of Education. So as a result, from undertaking this literature review, having gone out and spoken to the actual people that were doing the work, some of the managers, you're thinking, okay, look, if we're going to put a framework together that's going to work for Pacific, what would it look like? If we're thinking Pacific, sexual health promotion, strength and vitality. Our Pacific model. Or is it? Okay. Actually, no, here we go. Okay, I know that there's a lot of text in this, and I know that it is definitely in the readings that you've got there. And I'm not going to read out each and every particular outcome and goal, but it should actually look familiar to you. Because this figure, the bits highlighted in yellow, highlights the overall New Zealand national objectives and outcomes when we're thinking about sexual and reproductive health promotion. In terms of the Pacific framework, it's been designed to be embedded within this. So I will actually talk about the actual overarching aim, the 3 principles, 3 guiding principles, as well as 3 key performance indicators. So, the aim of this Pacific framework, it's actually got a dual focus. The first, when we're thinking about to help build healthy and strong Pacific communities by improving their sexual and reproductive health status. So we are actually looking about, when Huturo shared, the end goal is looking at strong and healthy Pacific communities, not individuals. You can't separate and isolate sexual health from everything else happening in that person's life. That's the first focus. And envision that as a second focus as well. And to support Pacific communities to lead a social change in the way that sexual and reproductive health is viewed. I've got to acknowledge that there's been some amazing work that's actually happening out in our communities, with the work that's been undertaken. However, when we look at the literature, if you think about the conversations that I've had with young people and even providers themselves, unfortunately there hasn't been a dramatic shift, to now. This is still a topic that is still silent and taboo. And there are examples of great work happening in various communities, but it's actually, we need to harness those energies and actually build momentum from there. Because I think, 15 years' time, are we going to be meeting here and still saying that it's still too hard, it's still taboo, we can't shift and work with these communities? So as part of the framework, there are three guiding principles. And one of the principles is about Pacific solutions. And it's about, nothing about us without us. So don't go and develop your program and think, oh, something's wrong with the community, when it doesn't work. It's actually about involving, the community, whether it be Pacific from the beginning, from the outset, all the way through the process and until the end. And I've got to share with you an interesting question that was asked my way when I first came on board, and it had to do with that other, bigger picture thing. It was like, okay, what would your comment be? And I guess there's two schools of thought, thinking, okay, do we add another box that has Pacific there, so that actually says, oh look, they have to remember Pacific, so hopefully that also means there'll be funding allocated to them. Where I position myself, I'm probably of this, of the latter, in the sense that actually, if you get all the principles right, it'll flow through in everything. And so the second value was about Pacific values, and we talked about it. The things that we hold dear. And I guess I believe, I'm talking to a group of I think, you already converted. These principles, you already know this, you already practice it in your day-to-day work. It's about family, it's about collective, it's about honour, spirituality and relationships. And I'd like you to think, imagine you've been asked to deliver your program. You're going to go into my local church, you're going to talk to my mum and a group of adults that are aged 60 plus. There's men and women, and you're going to talk to them about sexual health promotion. Now, are you going to go straight in there, pull up your pictures and just launch straight into it? And have all of them seated together? I think I'm making a huge assumption in knowing that you probably know how to address and make them feel safe and comfortable, about this topic. That you think about sharing who you are, where you come from, why you're doing what you're doing, and that you're considering that you'd like to split them into male and female groups. This is what this principle is about. Showing how do you show respect. And the next principle is about Pacific diversity. And yes, there are many similarities across the Pacific cultural groups, but also there's great diversity. And I'm talking about cultural practices, generations and their views on sexual health identity, the actual use of the Pacific languages, where they're living, where they were born. So like if you're going to be delivering a program, how would this program acknowledge this diversity? And in terms of the picture that I use, that's to demonstrate, the face of our Pacific kids, where we've got a mixture of, Samoan, Tongan and Cook Island Māori kids all in the one family. So I guess, I know that I'm in a room of experts, and so when I share these, you'll say, oh look, I know that, that's nothing new, same old, and I do agree, in one of the interviews, I interviewed a well-known Pacific male sexual health leader, and when he asked what I was doing, I was like, oh look, I've been asked to develop this best practice framework. He was like, oh, it's already been done. We did it in Wellington 15 years ago. Go look up the stuff there. And I guess, he was right. But the difference is, I believe that we've got something now that's documented and presented in a way that fits the world of our policy agents. So the other, in terms of these principles, they're all interrelated. One does not stand out from the other in terms of, hierarchy. And with the framework, it actually identifies 3 priority areas. It does have an outcomes focused. So this is where we want to go. These are the kind of principles that you've definitely got to make sure are part of it. And how to go about it. What should you be looking at? And these were based on the, the conversations that we had, as well as reviewing what had been written. So, service provision that's evidence-based and culturally sound, a focus on our Pacific youth and families, and a focus on leadership. So, in terms of evidence-based and culturally sound service provision, I guess we might be aware of a lot of the works in terms of Douglas Kirby, all the international work, a lot of those theories that talk about how do you change behaviour as such. Kind of things you'll hear associated with statistics, numbers, control trials, logistic regression, p-values, theoretical underpinnings. There are some that sort of hold the view that this is the only measure of effectiveness. However, in terms of the actual Pacific framework, it's actually saying, no, we acknowledge that that does have a role. That's important. That actually tells us if we're delivering the program, yes, it will actually produce results. However, what needs to be part of that is this is about being culturally sound, culturally appropriate. Because in terms of what often you find, when you might look at some of the things from Douglas Kirby, there might be like a 13-step, component about effective, delivering effective education programs, and it might say, in bullet point 3 might be make sure, it's culturally safe, or it matches the community. However, I don't think we can reduce it to that. If anything, both actually have equal importance and weighting. And a lot of the literature that's out there in terms of Pacific writings, a lot has been done in terms of the qualitative sense, focus groups, the conversations. And this is where a lot of people have shared, look, if you're going to come, it's about, what your message is, who your messenger is, and how you're actually going to deliver it. And we've got some fantastic, they've sort of said, look, if you're going to come, please, it's about building relationships. It's about using mediums that will catch our interest and attention that we can relate to. It's about the real life stories. And that's what we're talking about when we're thinking about effective, with this group. And with many of the providers that we met with, they were able to identify a range of knowledge sources that help them deliver their practice. But definitely what I found was that, they weren't all able to identify one sort of set body of knowledge. It varied between different providers. So some may have been really strong in terms of the scientific evidence, some might have been really strong in terms of the Pacific way of doing things. You actually need both. And so when we're thinking about Pacific youth and families, looking back on some of the work that had been done 15 years ago, they had identified that you actually needed to focus on Pacific adults, Pacific families. However, what came through in the evaluations in those early stages was that it was too hard. It was too hard to work with the parents. They weren't going to shift, so let's just focus on the young people because we can get access to them through the schools. Too hard basket. 15 years later, we're still seeing, the same results. Everything you read talks about that these young people are from, a community, from a family. And this is what whānau order is all about. And so, when we're thinking about the focus, we need to, yes, focus on our young people, but also we have to focus on their families. They're getting these sexual health messages maybe just in their schools, but going home into other environments, and there's no follow-through. And the third priority area is about effective leadership. So this is saying, if you want strong and, sexually healthy communities, we need great leadership, Pacific leadership at all levels, from central government all the way to our local aonga amatas. And this is about champions, people who are credible, courageous to have these kind of conversations. Because we're talking about an area that, to this group of people, this is, this is your everyday language. However, I found when, I had to go and speak to a group of ministers, and, sometimes when you're so versed in your in what you do, sometimes you realise actually presenting to a different audience, you've got to remember where they're at. You do have to be thick-skinned. So, one of the first questions I got asked in one of the other interviews is this document, is this framework, is it going to sit on someone's shelf? Yes, you've gone and done this, you've interviewed us, is it actually going to just sit on someone's shelf? And I guess for this framework, to be effective, firstly, it actually has to sort of highlight and say, okay, this is the reality of sexual health promotion. It's got to be real. It's got to make a difference. It needs to sit in an overarching framework. It can't stand on its own. Yes, we had the strategy that was released in 2001, and later there was a toolkit. But what follow-up has there been since? In terms of this framework, it stresses the need that we actually need a youth and Māori framework and a disability one as well. And these need to actually hang off a national framework. So these 3 action areas are all interrelated. And, within the actual document that you'll read, there's a whole bullet-pointed list of, actual KPIs and things to consider. I think I've done enough talking, because I'm looking at the room, so and I've heard my voice a bit too long. So what we're going to do right now is, just got, just to see how well, that you can actually go and tell your neighbour about this particular framework. There's a series of 4 questions, and I'm just going to give you a couple of minutes just to soak in, what you've heard. And there is a prize for the winners, and I'm going to ask my brother V if he might be able to get some music going for us. So I'll give you just a couple of minutes just to sort of sit with it, let it soak in, and then with these 4 questions. In front. So you've all got your answers. You're, just thinking away. Sorry, and I had to sort of share that song with you because Paula and I take Michael as well, we go to our local Zumba church, and so this song came on and she busted her dance moves, and I was thinking, okay, already I have to prepare for those kind of conversations with her. So, so we're talking about effectiveness and ways of approaching our tamariki. So but in terms of the actual activity, so for those in the audience who sort of answered these correctly and honestly, the correct answers are for 1. Okay, so the aim of this best practice framework is D, all of the above. Yep, we want to build healthy and strong Pacific communities by improving sexual and reproductive health status, to support communities to lead a social change in the way that sexual and reproductive health is viewed. And do we have any takers for number 2, the guiding principle that does not feature in this best practice framework? B, yes. We do not want passivity, peoples. It's about Pacific values, diversity and solutions. And in terms of question 3, the key performance indicator not identified in this best practice framework? A. Yeah. So stop looking at each other going, okay, all right, it's not about competitiveness. And question 4, this best practice framework will help as it will. A, B, C or D? Fantastic, all right. And so your prize is that you'll get a free, okay, have we had morning tea for tomorrow? Oh, no, so morning tea for tomorrow, you can all have it free, courtesy of me. So I guess just a few more things. Throughout the course of the presentation, I've identified some of the challenges that are inherent in the nature of this work. In terms of advancing sexual health promotion, and I think not only for Pacific but for Māori as well, I'm going to mention a few more that I think are really pertinent to this field. Okay, competing government priorities. So what's the flavour of the month? And the reality is that we do need funding to do the work that we do. However, there are scarce resources in this current environment. And so sexual health promotion is up against a number of other competing health priorities. For example, most recently, feeding hungry kids in schools, rheumatic fever. And these are all important as well. And these are kind of realities of what you're faced with. this concept of quality services. You know, the question came through in some of the interviews. You know, how do we know that our Pacific communities, when they're accessing or receiving, you know, sexual health promotion services across the board, how do we know that what they're, you know, receiving is effective? And this isn't just about, you know, those accessing Pacific and Māori services. What about those that are accessing the others? A huge one is defining what is success. What is effectiveness? You know, within the area of sexual health promotion, it's actually quite complex. And there, you know, there are a number of things that you've got to take into account. So maybe, you know, your program, the aim is actually to raise awareness. And you might have done this. But is it, you know, captured in the current stats when really, you know, sometimes a lot of the focus is on actual, you know, outcome or behaviour change? You know, there's a decrease in the number of people getting STIs. But what about the fact that they actually feel empowered, you know, and are actually having, you know, great and fulfilling, you know, sexual relationships? How does that measure, you know, compute through with these end goal statistics? And this concept about health promotion versus clinical services. And someone amazing that's in this room shared with me in one of the interviews, you know, when they were talking about the work they were doing with a fellow health professional, you know, it was labelled, oh, that airy-fairy stuff. You know, it's enough that you're trying to do the work that you're doing with the people, you know, with our communities. And these are the kind of attitudes that you have to face in your own workplace. You know, what do these kind of comments reflect? So I guess in pointing out some of these, you know, the realities and the challenges, it's, so what? We too. You know, I think that's the beauty of this forum. You know, that there's an opportunity given to discuss these things. You know, are these things acceptable? Or is it just the way things are? Or maybe should things be shaken up a bit? And I, you know, for one, you know, believe that you guys working in this field aren't afraid of, you know, you're not afraid to rock the boat. So I guess this afternoon, I've shared with you what this framework, you know, sets out to do. You know, the one overarching aim that has a dual focus. It's got 3 guiding principles and 3 key action areas. And I've talked about some of the tensions involved. And so my measure of success is that you'll be able to actually go and tell your next door neighbour, you know, about, you know, some of these things about this framework. And my version of success is, even if you can't really say, oh, okay, you can't list the 3 things, etc., that this is the image of Pacific sexual health promotion. You know, let that be your visual diagram. Okay, all right, sorry. Go. So before I end, you know, I'd like to acknowledge Manaia Paki King and Ngāri Sandel in the Ministry of Health. You know, I once heard this statement: if you aren't at the table, you're on the menu. You know, I think really we're really fortunate to have champions that are committed to this cause, who are sitting at their tables doing their part. You know, these are our leaders. And yes, it might get awkward at times in terms of funding and reports being due and evidence, but I don't think we should lose sight of the bigger picture and the bigger vision. How can we support them in the role that they have to do when they've got to actually try and advocate, you know, for the work? I'd like to thank Te Pō Waitapu, Alison and the team. You know, thank you for this invitation to speak and share about this work. You know, and you guys walk the talk. You know, when we talk about values and practice, you know, I thank you for the support that enabled my family to journey with me. You know, thank you for making them feel welcome. You know, to all my future babysitters for tomorrow. My son's definitely got a tongue and appetite. But but I also want to acknowledge my husband Pete, because, you know, through his support, you know, he enabled me to give birth to this framework literally around the same time I gave birth to Michael. So to all of you present here today, I wish you all the best with the upcoming conversations. I pray a blessing to you, your families, and the lives that you'll impact. You know, I started the presentation with the question, reach for the stars. Is it easier, you know, is it easy as it's said to be? And I guess, I think this framework is one amongst many, and I'll leave it to you to answer the question, can it be reached? I will be here throughout the consortium, so feel free to come up and say hello. Malo le ona sai, o iu le tātou whakamoemoe, alofa le atua, pui o tō wala, whawhitai, whawhitai, whawhitai te le lava.